Welcome. Welcome to our next session of Open Evening. We are the Herts Essex Fertility Center, and this session is designed to give you a little bit of information about who we are, what we can offer you, and what treatments you can have here. So about this presentation, we're going to let you know what we have to offer. We'll be talking about an open day that we've arranged where you can actually physically come and visit us and see what the center looks like. Throughout the duration of this session, there is a Q&A session that will be running parallelly, and you can ask your questions. At the end, we'll be asking you for your very valuable feedback, which can help us design this to suit your needs better. At the end, we'll be showing you a clinic video which tells you what the clinic looks like, and we'll end only after we've answered all your questions. So let's begin. I'm joined today with Jackie McAdam, who's one of our senior fertility nurses. And as I speak, she is waiting for you to post your questions in the Q&A box. And she'll continue to do this throughout the course of the session. And we also have Mana Marks with us, who's our marketing manager, who's organized all this, and who will be answering questions as well for you. So let's begin with a brief history of our center, which was founded in 1989. We have over 35 years of experience and have, to our credit, over 8,000 babies. All procedures are done under one roof, and you won't have to go anywhere for any part of your fertility journey. We are a state-of-the-art, purpose-built unit and have the entire range of services to offer you, irrespective of what your fertility needs are. So, whether you're a single person or a couple, we can offer fertility assessment, and depending on your situation, this may entail either a single visit for a man or couple visits in case of ladies or couples. We can offer 3D ultrasound assessments, which may be a gynae scan. You may have been told that you've got a fibroid, or you may have heavy periods and you're worried about something being wrong. You may have been asked to check your tubes. We can do all these tests for you in order to help you move forward and get answers to your doubts and questions. In order to be able to conceive, it's important to have a holistic approach, and fitness is an integral part of this approach. A healthy mind, a healthy body, and lifestyle can go a long way. And we have a website called www.fitforfertility.com. I would like to encourage you to go on this website, where you can get a lot of information as to how to approach fitness in a holistic manner. A little bit about the treatment pathway. We have a platform called Fertility Consents, which is where you first log in your details. You would complete forms that would help us assess your particular situation. This would also enable you to upload your passports for identity purposes, as well as any relevant investigations that may have been done for you, either at a different clinic or with your GP. And once you have done this, then we would book you to come in for a pre-assessment visit. This is an in-person appointment, obviously, and we would take this opportunity to check you and make sure your blood pressure is okay. We would check your weight and height and calculate your BMI. The reason for BMI is because we are a standalone center, and we have a cutoff of a BMI of 34 in order to accept patients, and this is for patient safety reasons. On this occasion, we can also take the opportunity and to do your blood tests and semen test. If you've already had this at a different place, you may be able to avoid that. And once we have the results, the next step would be the consultation with either myself or one of my colleagues, and the invitation for the consultation. This is going to be an online video consultation, and we would send the invite for the platform, which is Microsoft Teams, on the day or the day before the consultation. We would discuss your history, talk through your results, and outline a treatment plan. Any questions that you have will be answered, and we will help you start your fertility journey. We have a very useful app, which is called a Salve app, which we would encourage you to download. And this app, through this app, you can keep track of your appointments. You can find information about the different medicines that have been recommended for you. It also gives you a very useful tool to securely message us and ask questions and get answers. If you need to book an appointment, this can allow you to do that as well, rather than having to call and be waiting for a call back or waiting for the right person to pick up the phone. The next step, once the consultation is done, would be screening or bloods. Now, screening includes blood tests for HIV, hepatitis B, hepatitis C, and urine test for chlamydia and gonorrhea. If you haven't already had blood tests to check for egg reserve through AMH, we could do that at the same time. And we would also need blood tests to check for whether your body has the ability to fight rubella, so antibodies to rubella. We would check your hemoglobin level and hemoglobin type through full blood count and hemoglobin electrophoresis blood tests. It is important for these bloods to be done within 3 months of the day that you have your egg collection. So we will guide you as to when and how you should time these blood tests. Of the different fertility treatments that we have to offer, the simplest is IUI, which is an acronym for intrauterine insemination. This is a procedure where the healthiest available sperm is introduced directly into the womb at the time that you're expecting to release the egg. It can be done either in a natural cycle with no other medications to boost your ovulation, or with tablets or injections that would make you, firstly, ensure that you ovulate. And if you do ovulate, maybe even try to have 2 or 3 eggs to be released to up your risk, up your success rate. This, of course, comes at the risk of multiple pregnancy that can happen from more than 1 eggs being released. It mostly benefits those couples who are unable to have sexual intercourse, maybe because of psychosexual problems, maybe because of vaginismus or erectile or ejaculatory problems. Women who are using donor sperm can also use IUI to get pregnant. This may be either single women or same-sex ladies. Now about IVF treatment pathway. So this would start from your period. Once we've completed all the formalities, we've taken your consent, you wait for your period, and once your period starts, you would let us know, and we would book you for an ultrasound scan. This is the baseline scan, which tells us where your body is at that point. We find out how many follicles there are in the ovary, each of the ovaries, how big they are, right? And you start with injections that you take every evening. And this injection is going to help stimulate the growth of the follicles that are present in the ovary. Follicles are structures which contain an egg each. And you would need to continue these injections daily at the same time. And the duration of these injections may vary from anywhere from 9 to 12 or 14 days. The side effects that you can expect from these medications are an exaggerated version of what changes you experience during your typical menstrual cycle. You may also experience headaches, mood swings, breast tenderness, and bloating. Once the follicles start growing, these follicles are going to release estrogen in your body. This estrogen is going to thicken the inside skin of the uterus and thereby get it ready for accepting a pregnancy to start growing. But parallelly, what can happen is because there are several follicles growing, it can fool the body into thinking that it's ready for ovulation, and we don't want that. So about 4 or 5 days into the treatment, you need to start a second drug called cetrotide, Farmadel, and such. There are a few different medications that we may prescribe you. And this injection has to be taken at the same time every morning, and this will stop your body from causing an ovulation. While you're on this second medication, you can safely continue the stimulation process, taking the evening injections to keep the growth going and the morning injections to stop the ovary from releasing these eggs. Each of the scan that we will be doing while you're having the ovarian stimulation would be followed by a consultation with a nurse who would reiterate what has been told to you by the sonographer. Any questions that you may have can be answered, and we can jog your memory on how the injections have to be taken, or if you have any trouble, we can troubleshoot those as well. And the final scan is which usually is within 2 weeks of when your period has started, will be when most of your follicles are between 14 and 20 millimeters. At this time, we will give you the time for the final injection, which is called as the trigger injection. This trigger injection will cause some final development that must happen within the eggs and within the follicles themselves, so that you can have the egg collection 36 hours later. We will give you detailed verbal as well as written instructions so that there is no confusion and you're sure as to what the instructions are so that you can follow those. So 36 hours later, you will be coming in for egg collection. We will ask you to come in half an hour before the egg collection. We will admit you, take baseline observations. Your partner will be asked to provide a sperm sample, and we would do the egg collection under sedation. This is not a full general anesthetic, but sedation. You would still be breathing on your own, but you would be comfortable and not feel the pain while the egg collection is being done. The procedure roughly takes 30 to 40 minutes, and once you've recovered, we would discharge you. Now, what happens in the lab? Once we've got the eggs, depending on what your fertility requirements are, the procedures may be slightly different. Let's talk about the simplest, which is egg freezing. You may consider egg freezing if you haven't yet found the right partner, or you aren't ready to have a family yet, but you want to preserve your fertility. Because of the recent change, well, not so recent change in the HFEA rules, you can now store your eggs for up to 55 years. Okay. Now, the younger you are, the better the quality of your eggs is. And we would, if you're thinking about this, it is best to do egg freezing before the age of 35. It may be for social reasons. It may be because your mother or your maternal grandmother has had an early menopause. It may be because you've been diagnosed to have cancer or are requiring a surgery that is going to have an impact on fertility. And we offer counseling about this. The next step, if you're trying to have a family, it may be in order to get pregnant, or you may be trying to bank embryos for later use. We can do IVF. Okay, so we've got eggs. Now we need to create embryos. There may be different techniques that are required to make embryos, and the simplest technique is IVF. In order for us to do IVF, the sperm has to meet certain criteria, and they have to be normal at the consultation. You should not have had any previous IVF treatment where ICSI technique was used. Similarly, many patients have had IVF and there is either a low fertilization or no fertilization, meaning you have no embryos that form or a very few embryos form despite having a normal egg and sperm count. So all these patients would, if you have that history, we would do ICSI, where we would inject sperm into the egg. If you have a low count, low motility, or a low percentage of sperms with a normal structure, again, we would offer ICSI. Sometimes men don't have sperms in the ejaculate and require surgery to remove sperms either from the testicles or from the structures around testicles called epididymis. And in that case as well, we will need to do ICSI to make embryos using the eggs in the sperm. This is a video which shows what the ICSI, how ICSI is done. So you can see the sperm moving here. This is a micropipette, which is used to catch the sperms and inject it into the egg. But before the sperm can be injected, there is a procedure to flick the tail. And this is a crucial part of the procedure, which helps in enabling the sperm to fertilize the egg. Okay, so the tail has been flicked, it stopped moving, so it will be sucked into this little injection. And this is the egg, and we now inject the sperm into the egg. You'll see that she's pulling it back to make sure that the membrane is definitely ruptured so that we ensure that the sperm goes into the substance of the cell of the egg. And this might look damaged, but believe me, within a very short time, you won't be able to tell whether or not this egg has been injected with the sperm. Okay, so the last technique, which may be used sometimes, is called PIXI. And this is offered to those couples where the HbA testing, this is a test which is done at the time of semen analysis and tells us what percentage of sperms are able to bind to hyaluronan, which is a chemical present on the shell of the egg. So where the HbA binding is low, those men would benefit from PICSI in order to have a more normal fertilization. So once this is done, the eggs go back into the incubator and we would look at them the next day. And when we do, we need to examine what the eggs look like. And if you look carefully, you'll see two small circles within the cell. And this represents a normal fertilized egg. If the number is more than 2, that indicates that either 2 sperms have gotten or the sperm or egg had double the number of chromosomes. Such embryos are abnormal and cannot be used to, they cannot be transferred to achieve pregnancy. And then we culture the embryos in order to figure out which of them have the best potential to give you a pregnancy. What we don't want to do is put too many embryos back into your womb, the way we used to do IVF towards the end of 1900s. So 1990s, we used to hear of people who had 5, 7, even 15 babies. That happened because we were trying to have higher success rate by putting more embryos. Now, once you have multiple pregnancy, that puts the mother at risk. It also puts the babies at risk. So we've gone in the other direction, whereby we lay much more emphasis on selecting the best embryos so that we are not compromising on the success rate. And at the same time, we minimize the risks to the mother and the babies by minimizing the risk of multiple pregnancy. And in order to do that, we culture the embryos. So on the day 2 and day 3, so 2 or 3 days after egg collection, this stage is called as the cleavage stage. That is because the cell which the embryo started off with is still dividing. So you may see 2, 4, 8, anything up to 15, 16 cells. And if you grow them further, day 4 embryo is a very dynamic phase where this number of cells is so many that it is difficult to identify how many cells there are. And then at this stage, this is called morula. It looks like a mulberry. And then the following day, which is day 5, it becomes a structure which is called as blastocyst. There is a part of embryo which remains like a tight ball of cells, and this will eventually form the baby, while the rest of the cells are arranged in single layer on the inside of the shell. And as this embryo is expanding because of the number of cells within, the shell around becomes quite thin as well, and the embryo starts attempting to hatch out. You can see a little bit of embryo is hatching out of the shell here, and it will then try to implant. So at this stage, we need to transfer the embryo or freeze the embryo because we will not be able to keep this anymore. At Herts in Essex, we do embryo transfers 7 days a week at a time that is ideal for you rather than what is convenient to us. You will be given an opportunity to see your embryos, and we will take a picture for you to take away with you. We offer the add-on option of embryo glue. It is a special transfer medium which mimics the conditions in the uterus to maximize the potential of pregnancy to happen. We also offer the option of PGT. PGT is an acronym for pre-implantation genetic testing. Now, there may be different reasons for testing the embryo. The most common reason, which is applicable to almost all, is PGT-A. So this is a test where we take 5 to 10 cells of that part of embryo which forms the placenta, and we send it off to test how many chromosomes there are in the cells. So aneuploidy refers to the condition where the number of chromosomes is not normal. The number of chromosomes in human beings is 46. So if the number is different from 46, that is an abnormal embryo. And such an embryo will be rejected from implanting. And should it implant, you're at a higher risk of having a miscarriage. Down syndrome can still happen. Down syndrome is also one of the types of aneuploidy that can happen. And so by doing this test, we can pick those embryos that aren't normal. And this will help us select embryos that would give you a better chance of pregnancy and a lower risk of miscarriage. It doesn't automatically increase your chances of pregnancy. It just helps in better selection of embryos. So you can go to the right embryo sooner. So the time that you take to get to the right embryo is shorter. Sometimes either you or your partner may carry a gene which causes a serious genetic condition, and we can test the embryos to see if they carry the same genetic condition and select only those that are normal. Sometimes couples may have structural rearrangements. So one part of a chromosome may break and get attached to a different chromosome. And while you have the entire genetic information that is required to be normal, when you try to have a baby, there is an imbalance that happens that leads to miscarriage after miscarriage. So PGT-SR helps us pick out those embryos which are either completely normal or at least have a balance. So in that, they have the complete genetic information and therefore unlikely to miscarry. Any surplus embryos that are left after transfer can be frozen, so you can use this for a later pregnancy. In case you're doing PGT, you have to compulsorily do embryo freezing because it may take a week or 2 weeks for the results to come back. So this is the overall pathway that you would go through during IVF. About 16 days after egg collection or 12 days after a blastocyst transfer, we would ask you to do a urine pregnancy test. And if this is positive, we will do a scan to confirm that the pregnancy is viable 3 weeks later. The next fertility service that we provide is that of donation. We have an egg bank as well as sperm bank. Egg donation may be required if you're older than 45 or have had an early early menopause. You may have had chemotherapy. You may have had a previous IVF cycle and realized that the egg quality is poor, and therefore you may be recommended to use donor eggs to maximize your chances of pregnancy. Some women may be born without ovaries. Same-sex men or single men may require egg donation in order to create families. Similarly, sperm donation may be required for those couples where there is no sperm that is being produced. The man may have had chemotherapy or have serious genetic condition which they don't want to pass on to the progeny. Single ladies and same-sex female couples may also opt for sperm donation to complete their family. Surrogacy is the final service that we can offer you. We've done over 374 cycles since 2012. We have a dedicated surrogacy team, and this team would support both the intended parents as well as the surrogates. Many cycles may require egg donor or heterosexual and male same-sex couples. Sometimes single people using their own gametes may also opt for surrogacy for a variety of reasons. We have contracts with several ICBs for NHS-funded treatments, and this includes Mid and South Essex, North Central London, and North East London. Your ICB is determined by the location of your GP and not your home address. So if your ICB is in the Barking and Dagenham, Havering, Redbridge, Waltham Forest, City and Hackney, Tower Hamlets, and Newham, that comes in the Northeast London ICBs. And similarly, if your ICB is any of those given on this slide, which is Mid Essex, Castle Point and Rochford, Basildon and Brentwood, Thurrock, Southend, and finally Barnet, Camden, Enfield, Haringey, and Islington, we would be able to, you can choose to have your IVF treatment at Herts Essex. In case you have been told that there is no NHS funding for your IVF treatment or fertility treatment, you can choose to opt for egg share scheme, where you have a IVF treatment, but share the eggs that you have, thereby being able to afford the treatment. Similarly, sperm share scheme is also available with us. We have the May special offer, which is if you book your new consultation by Friday next week, which is 30th of May, instead of £250 for the consultation, we would give a 50% discount, and you would be able to have the consultation for £125. This does not include blood tests or semen analysis. We are going to be participating in the fertility show this weekend, which is at London Olympia. So if you haven't already purchased tickets, you can think about visiting the fertility show. It has experts from all over, and all types of experts are there. Lots of information that you can glean from there. We are also exhibiting, and we would love to see you there and meet you there. We have also organized an open day on the 31st of May. So if you would like to visit us and have a feel of what our center is like, we would welcome you, and we would love to see you here. Please book your 15-minute slot on the event page on our website. We would give you a guided tour of the clinic, and you would have a chance to meet the members of our expert team, including our consultants, nurses, and support staff. And you would be able to ask questions that you may have regarding your treatment. We have partnership with Access as well as Assured Fertility, and you can choose one of those. And they offer several different types of packages, such as multi-cycle packages, refund packages, as well as unlimited, IVF unlimited packages. Sorry. Okay. All right. So we are very, very big on wellness and Herts, and wellness at Herts, and Marna is forever trying her best to support and spread positive vibes through our different social media channels. We've recently joined TikTok, and we would love to engage with you on all our platforms, and especially TikTok. We're very, very excited about that. Please do join us and provide your feedback and likes. Diet is an important factor that we advise people about, especially if your BMI is higher or you need to lose weight for the optimal chances of pregnancy. We have very good data that if your weight is normal, your chances of pregnancy are optimal. The heavier you are, the lower your chances of pregnancy and higher your risks of miscarriage. So in order to maximize your chances, you can seek the help from dietitians and you can choose a dietitian that you like through the Association of UK Dietitians, and they can help you achieve a more optimal BMI. So finally, why us? And I think I've made it pretty clear. We have over 35 years of experience. We are open 7 days a week. So we will be able to do your embryo transfer on a day that is right for you. We have an electronic witnessing system. Lots of people ask us, will can there be a problem with the egg that I have? Is this going to be my embryo? So this electronic witnessing system allows us to be absolutely sure that we use the right egg and right sperm to make the embryo, and the right embryo goes inside of you. We have helped create over 8,000 babies, and we are very good in supporting you throughout your treatment. We are passionate about providing emotional support and, very important, free parking. Please complete the short survey in your packs to let us know how to improve the event. I think Marna will send you the link for the feedback. It might be there in the Q&A session, Q&A window as well. We would love to hear from you what you think about the session, how we can tailor it better to suit your needs, and how we can make this work the best for you. Please follow us on the social media channels that we have. That includes Facebook, X, Instagram, LinkedIn, YouTube, and TikTok. To book an appointment, you can call us on 01992 78 50 60. You can also email us. Currently, we are having a very busy time, and the new consultation is usually available within 6 weeks. But within this 6 weeks, we would arrange for you to have a pre-assessment and registration, so that you are seen within the 6-week period, and we are trying to reduce the waiting times currently. I hope you've been asking lots of questions and keeping Jackie busy. Before we go, I'm going to show you a video of a virtual tour of our center. So I'm going to stop sharing this. There is no sound. Sorry about that. Okay, I'm so sorry. There was a power failure at my end, so I'm going to try and restart the video. I'm so sorry. I do apologize. I think I see the other file. Sorry, I think use slide now. Inside the first slide. I can't believe it, so I usually not on mute. Okay, so that brings us to the end of this virtual tour, and this session will continue till we've answered all your questions. And I do apologize for the break that we had, unfortunately, because of the power failure. I'm so sorry, but we do look forward to seeing you and welcoming you in person here, hopefully at the fertility show and or the open day on 31st of May. Have a lovely evening and keep asking questions. Bye-bye.